We recently released a joint statement with the Association of Dispensing Opticians on the importance of maintaining high standards of infection prevention control procedures. Now that most optometrists, dispensing opticians and practice staff have received their COVID vaccination across all of the UK, we have made an important step forward in protecting staff and our patients from the effects of COVID. A remarkable achievement. However, 1 year on, and general restrictions in the communities are in the process of being lifted, we are now at a point where infection control complacency poses its greatest risk. We're a step closer to the end of the pandemic, but according to public health officials, it's likely there will be further infection waves in the year ahead. New variants of concern, and that's why maintaining these high standards is so important. COVID transmission continues to be possible even following successful vaccination. So, what's the background to our joint statement? Prior to COVID, the World Health Organization found that clinicians often overestimate their compliance with measures such as hand washing, and this was a major cause of healthcare associated infections. During COVID, this changed. When all clinicians and providers maintained the highest possible standards, healthcare associated infections like MRSA, C. difficile significantly fell. So we know what we can achieve, and we do not underestimate the risk posed by IPC complacency. In particular, the basics, scrupulous hand washing and disinfection after every patient episode. Both ABDO and we, the College of Optometrists, urge all employers to support their clinicians and their teams to maintain the highest possible standards of IPC controls. And they're the standards that have been adopted and maintained throughout the pandemic that have been proven to keep practices safe. For employers, we'd really urge them to ensure that all of their teams have adequate time for infection prevention control. They have access to enough PPE and consumables such as hand soap and surface disinfectants, and also to look at the internal data. Are practices using too much or too little PPE, too much or too little hand soap, and to use that information to help inform best practice. But remember, it's a partnership, and we also remind optometrists and dispensing opticians of the importance of clinical leadership, promoting and championing best IPC practice within your teams. Using team meetings to provide refresher trainings to everyone, hand washing, donning and doffing, and COVID triaging, and using lateral flow tests correctly. Registrants should set the expectations to the norm and reinforce IPC good behaviours amongst all of your practice teams. The College of Optometrists and Association of British Dispensing Opticians are working with public health officials, and we will keep the profession updated on any changes, and we will continue to ensure that all measures are appropriate for the level of COVID risk. In our joint statement, we've said that practice should maintain social distancing as directed by your government, ensure all staff wear a fluid-resistant face mask and follow the correct use of PPE, ensure scrupulous hand washing, ensure good surface disinfectant after every patient episode, and ensure all staff regularly use lateral flow tests and report the results. Despite the success of the vaccination programme, it's vital that we continue to ensure that practices remain safe spaces, and this is only possible by maintaining high standards of continued infection prevention and control. So, over a year on, keep up the good work and continue to do everything you can to ensure that your whole practice team can maintain these high standards.